From Weiner Brands, welcome to Enhance Your Life. I'm your host, Jonathan Small, and each week I talk to people from all sorts of professions and backgrounds about how cannabis has enhanced their lives and how this healing plant can enrich your life too. Hey everybody, welcome to the Enhance Your Life podcast. My name is Jonathan Small, your host today. We're going to talk about cannabis and pain. And a survey of medical cannabis patients found that 65% of patients reported taking cannabis to relieve pain. And of that group, 80% reported that cannabis was very or extremely helpful for managing their pain. So what do we know about cannabis and pain? To talk to me about this very important topic, I can't think of a better expert than Dr. Michelle Weiner, who is known as South Florida's medical cannabis and CBD expert and educator. Dr. Weiner is double board certified in interventional pain management and physical medicine and rehabilitation at the Spine and Wellness Centers of America, and she is the chair on the Florida's Medical Cannabis Advisory Committee. And Michelle, Dr. Weiner, practices personalized medicine focusing on the root cause and offering individualized, holistic treatment options. Dr. Weiner, thank you for joining the podcast.
Thank you for having me.
First of all, how did you get into, you're a medical doctor trained at the University of Florida, right? University of Miami?
Yeah. I went to undergrad at University of Florida, and I did my residency and fellowship at University of Miami.
A Floridian education.
But I'm actually a New Yorker. I'm originally from New York, but my grandma lived in Florida. My parents now live here. I came from a family of golfers, so they kind of wanted to migrate here. So all my training was in Florida.
A lot of traditional doctors, people with MDs, are kind of there's a stigma around cannabis, but you embraced it. And I'm wondering what the backstory is there.
I did a residency in physical medicine and rehab, which is more geared towards musculoskeletal and orthopedic type injuries and traumatic brain injuries, spinal cord injuries. So it was a little bit of like neurology with orthopedics. And then I went on to interventional pain management. And so in pain management, we learn really how to prescribe medicine, how to do injections. We give physical therapy prescriptions. But being in South Florida, we have a huge opioid epidemic. I had a personal story where my grandma, who had pain for many years, was on tramadol, and she actually had a really bad outcome from taking tramadol that ultimately led to her passing away. And so, I had like a personal conviction to really work with the elderly who had chronic pain and really try to advance my tool set. And so I was pretty frustrated once I finished fellowship, the fact that I was just like, it was just kind of like Band-Aids. And I really am the type that is a little bit more holistic, wanted to get to the root cause of people suffering. And I look at pain, different than a lot of the interventional pain doctors. I look at it really, what I say is the biopsychosocial model of pain, which means it's not just tissue damage. It has to do with people's emotional experience, their personal and social experience with chronic pain, how it affects their lives. And so when you see someone who has complaining of pain in a specific area, there's more questions to ask, than just, where does the pain refer to or what started it? But a lot of people who have chronic pain, they're also not sleeping well, they're depressed, they're anxious, and there's more to the story a lot of times, especially those who, I'm kind of fascinated with those who have acute pain that go on to turn into chronic pain, and why certain people are able to control their pain and why others aren't. And so when cannabis became legal in 2016 in Florida, I just started learning as much as I could and really trying to see if this could be an option that I could offer my patients. And I, was one of the first doctors to start recommending. I learned a lot about CBD and cannabis pretty quickly. And, it was really more self-taught and kind of like a bottom-up type of education where the patients were telling me about the products they were using. And I was trying to learn as much as I could from people who worked in the dispensaries, a few other physicians in other states. And so I just immediately saw, even just from offering CBD instead of, an anti-inflammatory, how many people were able to substitute a pharmaceutical for, using cannabis or using CBD. And I realized that it's one medication or one plant that doesn't really have toxicity. There's no, real potential for overdose, and they can use it for all aspects of their lives, not just really treating the pain that they have at the moment, but in treating the pain, it also helps their mood. It also helps with sleep and many other, inflammatory conditions, let's say. So it really started changing my practice, and I was very impressed with it. And so I really kind of changed the way that I practice, and I started doing a lot less interventional injections and sending it to my partners in my practice, who were very happy to then send me the cannabis ones as well. And then, from there, I really just started learning about how to use cannabis properly for chronic pain and acute pain. And the nice thing about it is that, we talk about the side effect of using cannabis is really that ability to change consciousness, right? And so I really started to, over time, be okay and be comfortable telling patients about the fact that, yeah, you may feel a little psychoactivity, and that may not always be bad. And I think that, people were a little bit nervous at first to tell me that they were smoking marijuana, illegally, and the most important thing is trust, right? That the patient and I have a good relationship, that we have this alliance, that, what I recommend, whether they like it or not, that at least they'll give me their proper feedback and be honest. And I think that's really important for a doctor and a patient to have. And so with cannabis, people just started opening up a little bit more, and it was giving them hope, hope that they're maybe not going to always be in chronic pain, or hope that they can return to work or be more active with their grandkids. So it really, it just, has transformed my practice and the way that I view medicine. And I'm very big on, kind of merging Western and Eastern medicine. For acute things, we use Western. For chronic, let's be a little bit more open-minded to some of the natural approaches, plant medicine and physical movement and nutrition. And really, once someone starts cannabis, they make diet changes, they start to exercise again. And a lot of that, I think, has to do with the fact that our endocannabinoid system works in a way where the receptors are all over our, brain and body, but, more so that they can have that ability to connect with themselves. Like within, minutes, they really can just change their perspective on what's going on. So it's been amazing. And I'm so grateful. I always say that I am practicing at this time in my life, because I think I would be pretty frustrated if it was like 10 years ago.
Exactly. And what you're doing is so important. You mentioned opioid addiction. How is the way cannabis interacts with your system different than, say, some of the pharmaceutical painkillers that are out there? And, what is happening from a biological perspective that we know to your body when you take cannabis?
So because we have this endocannabinoid system where we have, our body is wired to use cannabis, or at least be activated by our naturally occurring cannabinoids. And so when they discovered that we have cannabinoid receptors in our brain and our spine, in our immune cells, our abdomen, all throughout our body, they really started looking, well, why would we have these receptors? Is it, just smoke the cannabis plants? And so they realized that we make these naturally occurring cannabinoids. And the whole point is really to keep us in balance. So if we're not making enough of our naturally occurring cannabinoids, or our cannabinoid receptor density is affected, then our body is going to tell us, we're not in balance, whether that's pain or depression or sleep. It'll let us know. And a lot of it has to do with our neurotransmitters. It kind of keeps them all in balance. And that's really an oversimplification, but the difference is the cannabinoid receptors, at least the CB1, is located in areas of the brain which are controlling nociception or controlling pain. And there is an overlap with the opioid receptors, which is why when you start using cannabis to someone who's already on opioids, there's this synergistic effect where it kind of widens the therapeutic potential so that they can take less of their pain medication. What's different is that opioid medication activates our opioid receptors specifically. And the issue with that is that those receptors are located in our brainstem. So people have the potential for overdose or respiratory suppression. With the cannabinoid receptors, they're not located there, so it's much safer. There's also cannabinoid receptors in our joints, for example, like, our knees and our hips, all throughout our spine, where the pain pathways travel. So the receptors are what really has to do with transmitting pain and letting us know. And that's why if you're using cannabis, you're able to take care of a lot of pain from a neuroinflammation standpoint and also nerve pain. So I think that there's a lot of studies showing that, the meds like gabapentin, Lyrica, they have a lot of side effects, cause sleepiness, confusion. And, cannabis is one of those that if you do a nice ratio of CBD to THC and you kind of take away the intoxicating effect, you're able to use that for nerve pain as well. I think one of the biggest things I've learned is looking at conditions like fibromyalgia, chronic fatigue syndrome. We call them endocannabinoid deficiency syndromes. And this really means that we're not making enough of our naturally occurring cannabinoids. And so we have to supplement with the cannabis plant. Like any other vitamin deficiency, we just supplement with the plant or the vitamin, right? So they've done studies looking at fibromyalgia patients who are on FDA approved medications. And they saw that people who started cannabis were more than 60% likely to say that cannabis was very effective for their pain, as opposed to the other three FDA approved medications, it's less than 10% very effective. And a lot of that has to do with the fact that think about fibromyalgia, it's chronic pain. They have issues with mood, with sleep. And so it makes sense that if we're deficient and we use the plant, everything gets better in our lives. And so I actually started using cannabis for the fibromyalgia population. And now we're actually doing ketamine assisted psychotherapy, which is kind of taking it to the next level where a lot of people's chronic pain may actually be because of trauma that they've had in the past that kind of gets stored in their body. So, the endocannabinoid system, there's so much promise. There's so many potential mechanisms that we can use for chronic pain, dealing with endocannabinoid system and the receptors, the enzymes, which is exciting for medicine. I think that, the biggest issue is that we're like 5% of the world's population and we use 80% of the world's opioids. So it's really like a physician driven epidemic with the opioids. We're the ones giving the prescription for the opioid in the emergency room, starting the patient off on it. And it really only takes about a week to get physiologically dependent on opioids. So it's a really great substitute. They've done some studies showing that there's been a 25% reduction in opioid fatalities from overdose when you have a medical marijuana program in the state. There's a lot of research now going into how can we help the opioid epidemic? What can we substitute for these people's chronic pain? And really, I'm finding that cannabis and, some people using ketamine assisted psychotherapy is very effective.
If you're using CBD, does there need to be some THC in there? Can you just use CBD alone to treat pain? I mean, I know each case is different, but I think it's a question, I think some people get a little bit freaked out about the psychotropic effects of THC. And so they might just want to start with CBD, but it seems like you need the full spectrum to really feel the benefits.
So CBD as an isolate, so just one of the cannabinoids from the plant, the mechanism of CBD is that it inhibits the enzyme that breaks down our naturally occurring cannabinoid. So it allows our anandamide, our endogenous cannabinoid, to stay around for a longer period of time. But CBD also activates 65 other receptors in our body, like TRPV1 is for pain, NMDA receptor also involved in pain. What we've seen is that you do need some THC to activate the cannabinoid receptors, because the CBD doesn't do that. It's just a modulator of the system, but it doesn't activate the CB1 or 2 receptor. Something like even beta caryophyllene, which is a terpene, that is a CB2 agonist that activates our cannabinoid receptor. So I find that for true pain, you really do need some THC. And the CBD does have a lot of medicinal benefits, but one of the best benefits of CBD is that it actually mitigates the intoxicating effect. And so once you're using it with THC, it kind of changes the shape of the receptor a little bit so that the THC doesn't bind as strong. So it becomes, for multiple reasons necessary for pain management. And I think there's, a huge psychological component that goes along with chronic pain. And the fact that we're trying to keep our body in balance, we're trying to promote our endocannabinoid system. That's another reason why everybody should be taking CBD with, a little bit of THC. And that's why they have the rule about the 0.3%, so that there's THC in there without any intoxication. But, certain conditions, like if you're talking about nerve pain, for example, I find like a 1-to-1 ratio is probably the best. If you're talking about, like, let's say inflammation or, osteoarthritis, maybe you can do a high CBD. If you have, acute pain after trauma or surgery, maybe higher THC. So it really depends the type of pain, but then it depends the person, because if they've been using cannabis all their lives, obviously they're more likely to respond better to THC, as opposed to if they're new to this and they're kind of cannabis naive, then we sort of start them off trying to increase the CBD and then switch over to a 1-to-1 ratio.
So it's very individualized, it seems like, especially your practice. I know you're very much into individualized medicine, and it's not just like one thing fits all. So if you're somebody who doesn't maybe have access to a Dr. Weiner, like what advice do you give people to know more about how to treat pain? Because a lot of doctors out there don't even think about cannabis as an option.
Well, first I think that there is a huge psychological component to chronic pain. And so, it is personalized medicine. And that's what I like about cannabis and ketamine, the route of administration, the dose and the milligrams, the ratio, and then the terpene profile. Like it truly is, personalized. But I think that it's not a bad idea for everybody to start on a full spectrum CBD and see how much they improve with just that. So that's usually my first step. And I'll generally start people at 10 or 15 milligrams of a full spectrum CBD product once or twice a day, and then go up every 2 or 3 days by 5 milligrams until they find an effect. And, a lot of people follow a similar guideline. And then if they're in a medical state and that's not effective, then I would have them go to try to get a medical card and, use closer to a 1-to-1 ratio at a low dose, like 3 to 5 milligrams to start. So I like the fact that it's personalized. It's just difficult because each state has their own conditions that allow people to get their card. But, it's also treating the emotional component behind having chronic pain. I think that's important, and that comes along with the cannabis plant as well.
Are there any cons in taking cannabis CBD for pain? I mean, we know all the cons with prescription drugs and opioids, but are there any things that you have to caution against?
Cannabis has so many receptors that it activates, right? So that's the nice thing about it. We call it pleiotropy. So the nice thing is that it is one plant that has so many potential mechanisms, but because of that, you do have to watch out for side effects or interactions with other medication. It goes through the cytochrome P450, it's metabolized in the liver, and there's certain medications, like when we talk about not drinking grapefruit juice, at the same time as cannabis, that's because it goes through a similar metabolic enzyme pathway. And so any other drugs that go through that, we try to have them take it at other times. So there can be drug interactions, definitely with seizure medications or antipsychotics and blood thinners. Those are the ones that I really watch out for. Obviously cost is an issue. I just saw a patient today who was asking, when do you think my Medicare will cover this? And I think the biggest issue is that obviously it's a Schedule 1, so it has to be descheduled first, but then they're going to make it very specific in terms of what, like, for example, what's the right ratio and dose in what form for osteoarthritis or for sciatica or peripheral neuropathy, right? So all of these pain conditions have different mechanisms, but every person's endocannabinoid system is different. So it's pretty hard to figure out that 10 milligrams of a 1-to-1 tincture, works for everybody's nerve pain. But the way that the pharmaceutical industry works is that that's kind of the lineup of trying to get things into a clinical trial. So once it's able to be studied and no longer a Schedule 1, I think there will be more studies. But the fact that it's so individualized makes it different. It makes it difficult to just say, this is the best form of cannabis for this pain for everybody. But we have, certain standards that we use depending if you're cannabis naive or you're a cannabis user for many years. And then daytime versus nighttime, of course, it may be different, or short-term versus long-term. So, that's a nice thing, but that's where it kind of gets difficult. So I would say probably drug interactions and the financial issue is the biggest. And then, there's a stigma that we're still trying to break, and how people are getting more comfortable saying that they're using cannabis. The other big issue is drug screening. So if you're looking at into a job that doesn't allow you to use THC, that's a huge problem. Like a lot of firefighters who have chronic pain or post-traumatic stress disorder are not able to use cannabis, which is really sad. Obviously, we all, if we have our medical cards, don't use it during work, or we don't drive while using it, but there's certain companies where the employer wins, right? So because it's federally illegal, it doesn't matter if you have a state that has a medical program, the employer still, makes the rules for that.
Let's say you're not having pain right now. Do you still recommend cannabis as almost like a daily vitamin just to maintain your health and keep your immunity strong?
I recommend usually between 15 and 25 milligrams at a minimum of CBD to almost anybody, just kind of as a wellness supplement, something that is promoting health really, and helps a lot with inflammation. And I think inflammation is a big cause of many different comorbidities and also chronic disease. So I think if people are using a full spectrum CBD product, they're able to prevent chronic disease. And that's what we've seen, because as we age, for example, we make less of our endogenous cannabinoids. That's why as we age, we have more chronic conditions. So if we're taking CBD, it's helping to promote and keep our neurotransmitters in balance. I think that, the other thing is, especially during COVID, it's important to kind of get our body into the parasympathetic mode, right? That rest, digest, and friend and befriend, like that's so important now. I think everybody's nervous system is kind of overactive, and I think people are very unsure of the future. And when there's a lot of uncertainty, I think it causes anxiety. So, there's been a lot of people who lost their jobs, having even today, I found out that one of the kids in my daughter's class has COVID. And so now for 14 days, we have to quarantine. So just like that, how things can be affected so quickly and our schedules change. I think during COVID, a lot of people would benefit from using CBD or cannabis just to kind of switch into that parasympathetic mode and really help people remain present, because there's so much worrying in the past and, worrying about the future or thinking about things and trauma that has happened in the past, that I think cannabis helps us stay focused in the present moment, similar to meditation and mindfulness. But some people need that catalyst to kind of get them to breathe or get them to practice mindfulness. So cannabis is really one of those options that can be a catalyst.
What about in your own life? How do you use cannabis to enhance your own life?
Well, I'm not a medical patient. I have used cannabis before, though. I definitely take CBD on a daily basis, and I think it's all about connection and consciousness. The fact that a lot is held in our consciousness, and I think it's kind of interesting how like the CB1 receptor, talks with our psychedelic receptor, our 5-HT2A, one of our serotonin ones, because I think people are almost able to get into a very dreamlike state, like lucid dreaming type of state, from using cannabis properly. And I think that it's just something that right now people can connect with themselves, or they can connect with others. But more important, I just think the fact that it's a plant and it's safe, and we have access to it, and we should be studying it as much as possible because of the effects it has in our lives. I just think it has a lot of benefit in terms of getting us into that, relaxed parasympathetic mode. And so, it's something that I have considered, being a medical patient. And, it depends. Right now, I'm fairly healthy, but I do understand the medical benefits of it. I just think it's amazing how within minutes, people can be in a certain rut, and then just kind of change perspectives immediately. There's not much else that can do it in such a safe way.
When you prescribe it, is it in all different form factors? Is there, topicals in certain situations, maybe edibles, tinctures? How do you often prescribe it?
So we recommend it because we can't prescribe it since it's Schedule 1. Usually I'm big on starting people off on the tinctures because it's the most flexible. We can start at 3 milligrams or 5 milligrams or 7. You could take more at night. Let's say it's, capsules or edibles. Edibles, you could always break them in half, but they take a long time. And capsules are kind of stuck at a certain milligram and you lose a lot of it. It's not as bioavailable. I do support vaping whole flower. I think that's the safest way of any inhalation that we have this whole issue in Florida now where we're talking about the 10% THC cap, which is just so silly because we're also, we have 85% THC concentrates, and I don't even know if they understand that, smoking cannabis flower that has 15 or 20%, is nothing like the way that, people are using concentrates. But the fact that it has the entourage effect, I do like to try to help people learn how to vape flower, because I think that flower in the form it was made is extremely effective because it still has all the terpenes in it. So tinctures probably, but I'm very big on the nano emulsions. So I'm doing a study right now with University of Miami. We're looking at the pharmacokinetics of nano water soluble products. And so the concept really is that if cannabis is fat soluble, once you consume it by mouth, you need phospholipids and bile salts in your body to take it from the small intestine into the bloodstream. And so that's why it depends what you've eaten, when you're using a form of cannabis. If you kind of turn it into a water-soluble form, then that process really already happens outside of your mouth. And then when you take it, it goes straight from the small intestine into the bloodstream. So it's much more bioavailable with a faster onset. So I'm very big on recommending the nano water-soluble products, assuming they're made properly, because there's also a lot of issues with people calling it nano and then it sticks to the bottles and it doesn't really get absorbed into a beverage. I also recommend the Weiner edibles, and we have one dispensary called Move or AltMed, I think is the other name, and they actually sell Weiner edibles, and I even think they do have nano edibles. So I love their edibles. I think they're a little bit more, they add the terpenes into them, they kind of have a little bit more of that feel because of the terpenes. It's not just a THC product. There's all different flavors. So people actually speak very highly about it in Florida. So I am in South Florida. My website is drmichelleweiner.com. And my offices are in Boca, Hollywood, and Miami.
Well, I wish you were in LA because you would be my doctor, but I'll just have to.
I would love to visit LA soon.
I'll just have to move to Florida one day. Can you please open an office out here? All right. Well, thank you so much for taking the time to talk about this important topic with us.
Thank you for having me.
Enhance Your Life is brought to you by Weiner, the #1 infused product in the U.S. Weiner's entire process is designed to deliver the same great experience time after time. They have spent years fine-tuning their recipes so that their products are delicious, consistent, and potent. For more information, check out WeinaWellness.com. That's Weiner, W-A-N-A, wellness.com.